All right. Well, good afternoon, everyone. Thank you again so much for joining the February BHAG meeting. Happy to have everyone here. Hope everyone is staying warm. I know it's a chillier day than normal. Certainly looking forward to spring. I'm personally not very happy with that groundhog Phil, who's declared it another 6 weeks of this. But we will hang out in the meantime, and hopefully everyone is able to stay warm. So to kick us off today, we have a really brief icebreaker. If folks would like to introduce themselves with their name, organization, and I know a lot is going on in the ecosystem right now. So really simple question, but maybe a loaded question for you all. How are you doing today? So anyone can feel free and unmute if you'd like to introduce yourself, or you can use that chat function. And hi, Dr. Blunt. Good to see you.
Hello, how are you, Taylor?
Doing well, doing well. We were just kicking off with an icebreaker here. If you want to do a quick introduction and say how you are feeling today.
Yes, forgive me, I'll turn my camera on in 1 second. My name is Dr. Shatia Blunt. I am in private practice in a mental health organization by the name of I Am Me, and I am tired today. I've been working all morning, and this is my last meeting of the day, so I'm happy to be here, but I'm also a little tired. Thank you.
Thanks so much for joining us, and hope that this can be the end for everyone, your last meeting of the day, and hopefully get to take a much needed break afterwards.
Yes, thank you.
Would anyone like to introduce themselves? Anyone else?
I also put tired today in the chat. Amber Allen, Office of Assessment and Planning and Prevention link. Tired definitely, but feeling productive. So pros and cons.
Anyone else? All right, well, we will go ahead and move into our meeting agenda. So we have a really exciting partner presentation. Denise Dunbar from the Behavioral Health Division, she recently introduced me to a new community partner, Synergy Family Services. Really happy to have Talia on today to talk a little bit more about their program and hear more about their services here in Prince George's County. Then we will transition into some planning discussions, and then we will wrap up with our community announcements and upcoming meetings. All right.
Thank you so much, Taylor. So my name is Talicia Islar, and I'm a Chief Program Officer for Synergy Family Services. Originally, I started at Synergy as an actual therapist, and then I ended up transitioning into a rehab specialist, and I supervised direct care staff for our PRP program. And then I went into management in PRP, and then I was a program director, and then eventually now I'm a chief program officer, and my focus at the agency is on outreach and marketing, case management, PRP, and overall just growth of the agency. Yes, so we can go to the next slide. So just to talk about Synergy, we've been a mental health agency for actually 10 years now. We celebrate our anniversary, and we're located in Hyattsville, Maryland. So we're a pretty large program. We have over 950 clients that are in therapy, about 100 or so in psychiatry services, and we have 500 PRP clients, age range from as young as about 5 into late adulthood. We take Medicaid and Medicare. We can go to the next. The next one was just showing topics to cover. So our value is that we value mental health care that's accessible to everyone. We strive to break down barriers to quality care by providing culturally sensitive and inclusive services. Our mission is to support an affirming environment for all individuals, regardless of background, ethnicity, race, sexual orientation, or religion. And our vision is to be a safe and welcoming pillar that's inclusive to everyone by providing genuine support, true advocacy, community resources, and hope. So, as far as our menu of services, so on top of our therapy program, we provide individual and family therapy, group therapy at times as well. And, we do have clinicians with varying specialties. We have psychiatry services, and, psychiatry / med management services as well. And then we do have PRP. So, for those who are unfamiliar, that stands for Psychiatric Rehabilitation Program, and essentially it's for clients who are struggling with their functioning as a result of their mental health diagnoses / symptoms. So when we think about the target client, we think about people who maybe you struggle with depression, and because of that depression, you're struggling with, for an adult, maintaining employment. For a kid, you're missing school because you're oversleeping. So, this will be the target client. For kids, it really doesn't matter what their diagnosis is. It's more so about their symptoms and their ability to function at home, school, or in the community. And then for adults, there is definitely criteria in terms of needing to have either like bipolar disorder, a personality disorder, something on the schizo spectrum, or severe major depressive disorder. So there is a list for that. But for those services, the kids are seen 4 times a month, adults are seen 6 times a month, and then they have groups. So for the groups, they cover, a plethora of topics. I mean, they have really gotten creative. But coping skills, anger management, it could be budgeting. We have a yoga instructor actually that is a part of our PRP program that provides some in-person yoga for clients, adults and kids, which has been wonderful. Meditation, even psychoeducation. They have book clubs. They do like game nights, recreational activities, cookouts, movie outings. So, they really do try to provide, that social aspect. But essentially, it's in conjunction with therapy. So as they're working on the skills in therapy, PRP is kind of the action-oriented approach. Um, so it's just to help the clients to kind of get back to baseline in terms of their functioning. So that's really just what they call recovery. So recovering so that you have an ability to maintain your symptoms and function independently based on your age level. We also have, and I'm going to jump around to the side, family support workers. So I will say one of the highlights of Synergy in general is that we're in Hyattsville, so there is a large Spanish speaking population there. Because of that, the agency created a family support worker program, essentially so that those staff members can provide translative services to families. That includes, reaching out to them to schedule appointments and visits. That's inclusive to treatment plan reviews, family sessions, etc. We also have a family support worker that knows American Sign Language. So we're just, working on trying to provide as much language accessible care as we can without having the funding to do so. But essentially, our admin team is also bilingual, Spanish and English. Our case managers, which I'll go into now. Our case managers, they are not when you think about case management from a social work standpoint, they don't necessarily, it's not targeted case management, but they do offer, resources, and they help clients with obtaining and maintaining their benefits. So we find that clients sometimes come in and they don't have Medicaid, but they are eligible. So the case managers work, hand in hand with the clients to help them to either get Medicaid and sometimes to recertify. So that's been really helpful for the clients. And then they provide what we call concierge case management. So from the beginning, when they enroll in services, they're reaching out to the client. They're, trying to ask them questions about like their transition. If they have any questions about the agency, what services we offer, if there's any challenges, going on that where they need resources, they're identifying that from the beginning. And then every 60 days, they're doing a follow-up for the client. And it's helpful because we're making sure that we're providing quality care. So at times, they really do have that relationship. So if they're having any difficulties with anything, they can reach out. Even if we don't answer the phone, they might call the case manager. Hey, I'm trying to get to the admin and schedule an appointment. So it really has been helpful. And then also post discharge. So when they leave the program, they still follow up just to see if they need anything, if they're connected to care, if their mental health is stabilized. So they also are bilingual as well. And we do have clinicians who are bilingual, like we recruit for that. So, and for those who don't, we have that family support worker program so that we can bridge the gap. We also have an abuser intervention program, and that is just a 12-week anger management group. So just the ideal, not Medicaid per se part, but like if a client is in need of just wanting that anger management, they need to maybe present it to court, etc. We have that for men and women in the evenings. And then we have a health and wellness program, which is fairly new. So I'm sure everyone on here knows about SAMHSA's 8 dimensions of wellness and how important it's becoming in 2025. So we built a program to support that. And essentially, they're responsible for enhancing the well-being and recovery of our clients and our PRP program. And they are responsible for just developing like health and wellness programs that not only touch the clients and families, but the community and staff. So that's what they do. Diversity, equity, inclusion. That pertains to staff, clinicians, clients, and the community as well. Just making sure we're being inclusive, making sure that we're learning, and they come up with education initiatives to teach community members and staff and clients. So we can go to the next slide. So again, our OMHC, we have 950 plus clients, 100 in case and med management, 500 in PRP services. We have about 100 clinicians right now, and then 35 direct care staff. So those would be the professionals that support the PRP program. They're offering virtual and community-based and in-office services. So we have some that are still going into the homes, and then some are virtual. And then we also have our office where clients do come in. Again, we are located in Hyattsville, and we really are trying to find a way and pride ourselves in that wraparound service. So we have the therapy, the psychiatry, the PRP program, and then we're building additional programs and working on initiatives so that we can make sure we can really meet the needs of the whole client. We can go to the next. So here's some of, and I'll just kind of let you peruse that, but here are some of the specialties that our clients have, so we're trying to ensure that we're equipped to address the care the clients need. And then when we find that there's something that we do need more support in, we are very big on training at Synergy. So on a monthly basis, there's at least a couple of trainings where we bring in external trainers to come in, even offering CEUs to our clinicians so that they can stay educated. So there's quite a few here. And then our intake process. So again, we accept Maryland Medicaid and Medicare. And then I would be remiss if I didn't bring up the system of care grant. So that's where Denise Dunbar looped me into this group. But essentially, the system of care is really for PG County kids who are at risk of developing severe emotional disturbances later in life. So that target population would be if you have a kid that is at risk of detainment, or, having legal issues, or maybe they are possibly being removed from their home, things like that, or being removed from school, so just, those more serious and severe cases, they can go through the system of care grant. And the grant does afford them the opportunity for coverage for individual, family, and psychiatry services. So that's been wonderful, as well, because even those who don't have insurance, can get covered through the grant. And then again, we do accept Medicaid and Medicare. So with the intake process, when we get a referral, which we do have a referral form. People do go through the website. Sometimes people have the form on hand, but once our team gets that, it's about 24 hours where they reach out. And the way our intake team is set up, it is where our intake clinicians have kind of opened their availability. So the admin calls the client, they're able to schedule them in the moment, which has been, helpful in just getting them an intake assessment right away. So the sooner the client is available, they are able to get that intake. I've even seen it happen same day before. So it just really depends on availability. So yeah, they schedule the intake assessment usually within the week. And then during the intake assessment, they are evaluated by a mental health professional just to determine diagnoses, if there's any referral needs. So sometimes a client can come in and maybe they need a higher level of care. That intake assessor is, doing whatever they need to do to get them referred if they are not appropriate for our services. But if they are appropriate, then they complete the intake, and then within 72 hours, they're assigned to a therapist, and then they get their initial session, and then they start their ongoing therapy services. So I did kind of touch base about the PRP program, but just to kind of add on, it's really hands-on. So, they can help with so many different things. And they collaborate with the therapist. So the therapist and the PRP worker are in collaboration so that they're able to best address the needs. We do accept external referrals, meaning if there's a therapist from another organization or agency and they want to refer to our PRP program, we're more than happy to accept them. They don't have to have all of our services to get into PRP. But I just wanted to highlight that. And we can go to the next one. Yep. So here are some of the groups as well that are on here. So we have groups about 6 days a week at different times of the day, which is great. But examples are they have something called the mothership, where the moms of all ages, I think it's at like 9 p.m. So like when the kids go to sleep, and they're able to brainstorm and just kind of build off of each other. And that's been really helpful. Let me stop and look at the chat because I did see a question. Must there be a referral first? Do you serve walk-ins? Yeah, we do take walk-ins. We actually get a lot of walk-ins. They come into the office, and as long as they have their information, we are able to schedule them on the spot. So walk-ins or referrals through our email box, website. So I get referrals all the time because, I have different partners and connections. So yes. Cheryl?
Yeah, when you say the walk-ins, as long as they have their information, by that, do you mean their ID, or is there something in addition to that they need?
Their Medicaid information. Yeah. So as long as they have that, because when they come in for services, we have to get the authorization. So they are able to get that on the spot. So it takes probably less than 5 minutes to go in and for them to apply for authorization. Once they have it, then we're good to go.
Okay. But you are handicapped if they don't have Medicaid first before coming to you. Is that it?
So if they don't have Medicaid because they actually don't have the insurance, then we connect them with our case manager to help them to apply for insurance.
Gotcha. Wonderful. Okay, that's wraparound to me. Good. Thank you.
No problem. Do you offer sliding fee scales? Sorry, I see that in the chat. Yes, we do offer sliding fee scales. So when someone is interested, then we kind of work with our team and we come up with a system, but we have definitely offered that. And we try to be reasonable and understanding of, income, etc. Thank you for asking questions. I love that. So for PRP group, we have Shining Bright, which is for minors, and it's talking about main character energy. And basically it focuses on building self-esteem, etc. We have a stress management group, and we have a goal setting group. So PRP is really about groups, and we really do try to get all of our clients that qualify into PRP because we love seeing that collaboration. We love it. It really does wonders on clients. Let me look in. I know a few PG residents that do not qualify for insurance or Medicaid. Yes, so we do offer the sliding fee scale for that. Okay, we can go to the next slide. Yeah, so All of our services are available in English, Spanish. Again, we do have a family support worker that also knows American Sign Language, so we're able to provide that culturally sensitive approach to therapy. And the families respond very well to it. Oftentimes, especially those who English isn't their first language, they build a relationship with their family support worker. They know they can reach out to them. Hey, can you let the therapist know I want a family session, etc. So it's been really helpful because we do not want that to be a barrier for quality services. So thank you. I do want to leave opportunity for any additional questions, any feedback.
Thank you so much, Talicia. Really appreciate that presentation. I'm curious, you talked about it a little bit, the system of care grant that brought about the partnership with the Prince George's County Health Department, our behavioral health division. Can you talk a little bit more about that? Are those referrals open to partners, or how can they go about getting involved in that program?
Yeah, so I will send you the link, but there's a website that they have where to access it. And I feel like I do have a referral form, so I can send that, but it does have to go through like the powers that be, like Denise's group. But the target population is 0 to 21. So again, anybody who is at risk of developing any type of serious emotional disturbance and could be at risk of entering the foster care system or maybe the juvenile system. So if you're seeing pretty disturbing behaviors where you're saying you have a client and you're like, wow, like, I don't know if this client is really going to be able to, stay away from the legal system, or, they're going to lose placement, etc. So any partner like school systems or, we've collaborated with school systems. We've collaborated with DJSNs a lot, obviously, DSS, but it is open to anyone. It's not, they're actually wanting us to expand and do outreach, do presentations where we share information because anyone can refer a client.
Thank you, Talicia.
No problem. Yeah, it's really good. The system of care grant is amazing, and they have a lot of services, not just therapy. I mean, they have a lot of various different services that support. Anyone else? Awesome. Okay, so I am going to send you an email, Taylor, just with a recap, with more information, some flyers and things about our program, and then also the system of care grant information so that maybe you can disseminate it to the group.
Great, will do. Thank you again so much for joining us. Really appreciate your presentation today.
Thank you all. I really appreciate you.
Thank you so much. All right, and I will be sure to share out communication channels here, some email addresses here at the bottom. I can share those out in our meeting notes so folks are able to get connected. All right, and so transitioning us from the partner presentation, wanted to take a few thoughtful moments during this meeting. We haven't had the opportunity to come together as an advisory group and talk about our work group goals for 2025 yet. Our co-chairs, they can't be here today. Margaret is out sick, and Nina Ward, our Prince George's County Health Department Behavioral Health Division, they are in a leadership training today. But we have Carlos is on the phone with us today. But we all wanted to remind folks that we want this work group to be as bi-directionally beneficial as it is the efforts that you all put in. And we want to make sure that we are giving back to you all and making sure that this is a group that you all feel welcome to join in each month, and that you feel that is productive and something that is of use to promoting all of the behavioral health work that you are doing here in Prince George's County. We are also receptive to the fact that the public health landscape is changing on a daily basis. And so we want to hear from our partners regarding any challenges that you may all have in your community facing roles in delivering programs or just being able to reach community at this time. Want to be able to have those open discussions to see how we can best support you and make sure that, again, that this work group is responding to changing priorities and that if there are specific areas of focus that we need to address, that we are addressing those here in 2025. So have a few questions to facilitate with you all. Please feel free. I know it's been a long day for us all and really just a, a long month, in fact. So feel free to use that chat function or unmute if you have any feedback that you'd like to discuss. You have full permission to be as messy as needed to get your point out, but certainly let your voice be heard. We want to make sure that, again, that we are being very receptive to your feedback and your priorities here in 2025. So to get us started, a question to pose to you all: what new or emerging challenges have we observed in our community that require our attention? And this can be related to mental or behavioral health, or it can be more of a general concern or challenge area that folks are experiencing currently. So I don't want to take our silence as misrepresenting what is actually happening, but are services, are folks still able to deliver services? Are community members still accessing services in the community? What's going on in everyone's day to day? Has it just been business as usual, or are we feeling any impacts?
I would ask a question. I'm new to the group, and one of the things I would say that I found challenging in navigating some of the resources in PG County. I'm in a private practice, and I've had some relationships with community-based organizations, and one of the biggest things that's come up is we've had clients who have mental illness but not co-occurring disorder, substance abuse, and there seems to be more programs for people with substance abuse as far as like housing. But we're not finding a lot of those resources in PG, and it could be me not knowing where to go with, to look for that. But if you can share some either resource that I could go to for that, or I know like Baltimore has a wealth of like I have a lot of services for people, and I've had some clients who actually went into the hospital in Baltimore just to get services there. And it's unfortunate because now they're far away from their family members who are in PG County, and to be able to have access to them, like if they have visits or things like that. So it's like those shared group homes. They're there for like 30 days. I know there's like crisis. There's one crisis bed place that I'm aware of, but there's no step down after the crisis is stabilized for them to have housing when they're not able to, for adults. I should put that out there for adults. Once they have crisis stabilization and being transferred back into the community, usually the option that we're aware of is a shelter. And some of them just really just need that treatment that those co-occurring programs offer. I haven't seen any just for someone who has mental, just dealing with mental health issues.
So after crisis stabilization, taking a look at some of those social needs after that crisis stage.
Like those, I can't remember. It's supportive housing, but it's that next level after crisis stabilization. I know Safe Journey House is a crisis stabilization um, place where they could stay, but then once they're discharged from there after a few years, like where do they go and still stay connected with that health, with their you know, um, with their recovery. So I've seen some really good work done for someone who has like I said, co-occurring substance abuse. It's wide open for them to be able to have somewhere to stay, and they have a housing person there. I mean, a house manager there. They may or may not have their own bedroom, and they're able to function and work and things like that. I haven't quite seen that just for mental health for people here in PG County. Not to say it doesn't exist, but I just don't know if it does. I just don't know how to access that. It's been a little challenging. That's all.
And any folks on the call have experience with transitional housing, locating those resources here in Prince George's County, or know of any?
I believe Vesta will work with people with mental health diagnosis, but we have very few dedicated to mental health.
Well,
let's okay.
I'm sorry. Well, okay, we have some new behavioral health facilities that have come online. There is a behavioral health facility on the grounds of Doctors Hospital here in Prince George's County. I believe we also have another facility that's located in what used to be what is the Capitol Boulevard area, where we at one time, what was that over there? That we had the big shopping plaza, and I believe there is a children's hospital, a children's facility there too. I can't, off the top of my head, I can't quite remember the name of it, but we do have 2 to 3 new facilities that have come online. And although I'm certain that they have temporary services that they can offer to the people that you described, but they can also perhaps link you to give information to someone about more permanent solutions.
Yeah, that's usually what I'm sorry, go ahead.
No. That I was ending that and wanted to transition to a response that I put to Taylor's question, because I'm surprised that I'm getting the kind of feedback regarding job loss here in the county. Our residents, this unpredictability. I'm getting a lot of phone calls. I don't want to make it sound as if my phone is ringing off the hook, but I'm getting more than I thought I would with regard to 2 areas. First of all, those persons that are losing jobs or feel that they're going to be on the chopping block, whether that's because of government downsizing or whatever you want to attribute it to. But then we have also those persons who have family members who are not here legally or are in the process of trying to be here legally, who are working, who are now walking away from jobs because they are thinking that that might be a way of them being identified and then shown the back door in terms of being exported, or what's the term that they're using? They're getting them out, they're rounding them up. I'm getting calls from people that I would not have ordinarily perhaps engaged because of this. So I don't know that we at this point understand the real impact that this is going to have on our residents in Prince George's County, but it seems as if it's bubbling up. I'm really thinking that is going to be something of quite concern over the upcoming months.
Thank you for that, Ms. Cheryl. I just want to close the loop really quick with Florian. If you wanted to put your contact information in the chat, we can certainly chat offline and hopefully get you connected to some folks who can address your question.
Okay,
Dr. Koganam, did you have anything else that you wanted to add?
Actually, I was just typing the link for the Luminous Health Care Center, the one Dr. Maxwell was referring to, the psychiatric hospital on Ungaluk Road, to the chat.
Good.
Thank you for that. And so, going back to what Miss Cheryl was mentioning there, so the induced stress that comes from sudden job loss, um, from changing policies around immigration here in Prince George's County impacting our community residents. Um, are there any resources that folks are drawing on, or any best practices that folks are implementing to help folks through these times? Is this an area that the advisory group needs to work on moving forward, or there other areas that folks would like to see more emphasis on in the new year?
Hi, I guess this is shifting a bit away from the job loss. I would say I have been I've been experiencing it as well. You know, many of my clients have lost their jobs. They're federal government workers, and it's been, you know, we're in this kind of collective shift as a community, as a whole. And I'd be happy to hear of any resources if folks have some, or maybe we can put out some guidance, you know what I mean, in terms of ways of coping or resources. Maybe our group can create something to disseminate. But in addition to that, or outside of that, something that I think that we may want to focus on is quality care. I know that we often, you know, we cite the behavioral health care shortage, et cetera. We can talk about burnout, clinician burnout. A clinician myself, or people that work in the particular space are burnt out, and oftentimes when we are in this kind of collective shift, traumatic for some, um, we are on the front lines, and there's not much concern about how we are doing as people who are in this kind of behavioral health space. So there's some opportunities there, and just overall quality of care. There are several therapists. There are several various programs. The woman spoke earlier about PRP programs and et cetera. The resources are there, and I'm not speaking disparagingly about her program in particular, but I think that, you know, there's some work as a community we need to do around quality, you know. And so I think that that's something we can pay attention to, or even maybe figure out how we are defining it, because oftentimes our metrics are really situated on kind of attendance and numbers, but not so much the quality aspect of care, which is very important and toward the goals of the county.
Thank you, Dr. Blunt. And if you have access to any of those evidence-based metrics for quality that you've seen or want to bring up to the work group, would be happy to collect those and get some reactions from the work group and see what would be feasible, or if we need to step in and take a look at the literature and create our own as a work group, or see how we may partner with between the behavioral health division or the LBHA, how we could get some sort of project off the ground.
Yeah, I don't know of any current metric that any standardized metric that we're using in space to measure the quality of care outside of like patient satisfaction surveys and, you know, the PHQ-9s, or like those kind of clinical health questionnaires. So I'd love if there's the opportunity for us to read the literature, you know, and kind of create something, or find something and adapt it to our context. I'd be very happy to participate in that endeavor with the group.
And I'm seeing comments here in the chat from Sylvia said, likewise, I've been getting several calls asking for rental assistance for individuals that have lost their jobs. So same, I'm seeing a common theme of we have these short, what seem short term here and now, what we can work on getting folks connected to, if we can get the providers on the call or community partners connected to some of these resources and expand awareness. If there are programs that we can get folks connected to, take a look at some of those evidence-based practices, again, to make sure that the clinicians are taking care of themselves while also pouring into their clients and providing those folks with the coping mechanisms and to get through all of these changes that are happening day to day. So I'm seeing that, and then hearing with Dr. Blunt as we're taking a look at creating this continuum of care, taking a look at our thought process of what does that look like? What does it look like to assess quality of care that is being provided here in Prince George's County versus quantity of care? Any other topic areas that folks would like to bring up? Any projects that you all would like to see the BHAG take on in 2025 or long term? Are there any gaps that folks feel that the BHAG could potentially fill here in Prince George's County when we talk about behavioral and mental health?
I believe so. For example, I think someone mentioned, so our communities are very diverse, right? So we have a large population who are in different situations. And one of them is we have a large population of immigrants here. And I have the privilege to work with with clients in Prince George's County and Montgomery County. And I see the difference between Montgomery County and Prince George's County in terms of mental health services. So I'm thinking, if we have any opportunity to maybe model or take on some of the programs that Montgomery County has. For example, we have a chance to connect patients with substance use, if they need mental health services, directly with a program, even if they don't have Medicaid. So I'm wondering if there's something, maybe there is already, maybe I don't know, and I don't know how to look for it. But I would love to see if we can work on creating more resources for our population that do not qualify yet for Medicaid or, to be able to purchase their own insurance.
Thank you for that, Sylvia. Yes, and what I can do, again, so we can have a better awareness of what is going on here in the county. We can hear from the Prince George's County Behavioral Health Division. We can hear a little bit more from the LBHA and try to figure out, what sort of programs exist, if they are already modeling our neighboring jurisdictions, or if this is again a gap that we need to step in and see, how could we advocate for those resources, or how can we what sort of evidence-based practices could we recommend? Miss Cheryl, you look like you wanted to say something. Do you have anything you wanted to add there?
No, listening, just listening. That was a very interesting question that she asked in terms of comparative and a comparative analysis between Montgomery County and Prince George's County as it relates to our immigrants.
And I'm going to put here in the chat, this is a Teams link to a meeting tomorrow that is taking place. Within our coalition at large, we have 4 work groups. We have a health equity work group, we have a community care coordination team, of course, the BHAG, and then we have a healthy eating, active living work group. Our health equity work group, they are going to be there. They meet on the 3rd Thursday at 3 p.m. So the day after you all meet. And tomorrow we're going to hear from a FQHC, a federally qualified health center, who works with Hispanic communities who predominantly speak English as a second language. They are predominantly Spanish speaking population, and so they actually conducted a needs assessment fairly recently, and so they're going to come and present the results of their needs assessment and talk a little bit about navigating these changing times and how to best show up for our Hispanic populations and some of the considerations when it, here we are in policy season, and again, how we can best support folks and make sure that we are reaching populations during these changing times and being able to continue providing services. So I'm going to go ahead and put that link in the chat if anyone is interested. And again, we're going to have that discussion about some of the challenges that you all are seeing. So I know, Ms. Cheryl, you talked about the loss of jobs. Sylvia talked about rental assistance and losing jobs as well. And so any of those changes that are also coming with changing immigration policies as well, we want to be sure that we're hearing from you all. Again, being that you are in the community, working with community, so we want to be sure that we are hearing you and best supporting our organizations who are on the ground. So that invite is available to everyone. If you would like me to forward you the calendar invite, please feel free to say so in the chat, and I can forward it to you after we get out of this meeting. And that's an open meeting to everyone. So if you think anyone on your team may be interested, feel free to forward them that invite as well. All are welcome to join us. And so as we wrap up this slide, are there any other innovations? I know we've talked about some of our partners in different counties, but are there any other innovations that folks can think of that they would want to bring to Prince George's County or explore as a work group? And continue thinking about these questions. And if you have any thoughts after the meeting, please do feel free to let me know. Again, this will be a iterative process that we go through, refining our work plan and figuring out how do we need to shift our focus as an advisory group and what do we need to focus on in 2025 and moving forward. So next, in talking about expanding our reach, making sure that we have folks at the table who are able to have these discussions and come together and discuss these challenges that they may be experiencing in the community and work towards a shared goal for more comprehensive behavioral health services here in Prince George's County. How can we engage more volunteers, partners, or community members in our efforts this year? Are folks a part of any other work groups or coalitions that we should reach out to and ask for representation or extend meeting invites to?
I think once we once we kind of define our charge for the year, we may be able to have some strategy in terms of who we invite based off of what we decided that we want to do. So at least that's my stance. I don't have anybody to add now, but if we are like, we decide which direction we want to take or multiple directions, then we can strategically invite people to be a part of the work group. My thoughts.
Thank you, Dr. Blunt. Anything else anyone wants to add? And are there any other partners that folks would like to learn more about? As you saw at the beginning of this meeting, we had a partner presentation. Last month, we heard from the Suicide Prevention Coalition. Are there any partners or any organizations in Prince George's County that folks are curious to know a little bit more about or have seen, before in previous partnerships but haven't gotten to connect with?
Hello, hi, this is Tanisha Whitlock. I recently discovered a facility, the Dyer Care Center. I don't know if they've ever um been a part of the conversation here, but I think that would be a really good guest speaker, someone that's also a part of the work group if they're not, just to give us a better understanding of their services. Because from what I've read online, it sounds like a really good resource here in Prince George's County, and it's a new resource. So that would be, I think that would be very helpful for the group.
Thanks, Tanisha. Yes, we actually had a presentation. I think it was the fall of last year. Faith joined our call from Recovery International, who's overseeing the Dyer Crisis Care Center. And so I can send you that presentation and her contact information, and also see if she could come back to a meeting and give a few updates to us all periodically.
That sounds good. Thank you.
Absolutely. Any other ideas for any partners or any programs folks would like to learn more about here in Prince George's County? And I know the social needs are certainly intersecting. You know, we had those discussion earlier about housing needs. And so any partners who I find who are in those spaces as well, I'll be sure to invite those folks so we can have better awareness.
I have a question. Do we have a sense of any like research that's being conducted in the area as it relates to behavioral health, maybe with some of the like local universities that may be, drawing on community members for research in that particular area? Perhaps they could come and just kind of highlight like research that's happening, and if they are still recruiting for participants, etc., perhaps we can support them in that way in terms of referring people to their study. But if there's any like active research that's happening in the behavioral health space, perhaps we could learn more about that.
Yeah. Does anyone know of any current research initiatives happening here in Prince George's County? Is anyone mentoring any students from any local universities or the community college?
No.
Well, I will put that on my to-do list. I can certainly reach out, and I'll reach out internally as well to the health department employees and see if anyone is mentoring students this semester and find out what there is, what's going on and what we can get involved with.
Yeah, thank you. Thank you.
Absolutely. And next, want to move into this question here about enhancing the volunteer experience. So those of you who are already active, what changes or improvements can we make to ensure our volunteers have a more rewarding and impactful experience? Michelle?
I'm sorry. With regard to the comment regarding research, John Hopkins, there's an office over there where there's a lot of work being done to make certain that research includes persons from the minority communities. Let me get that person's name, and I'll get it to you, Taylor, so that can be a part of the landscape as you look into that area to report to us. But let me give you a contact person over there.
Thank you, Ms. Cheryl.
Mm-hmm.
Any ideas on how we can make this a more rewarding and impactful experience for you all? Anything you need to best be able to do your jobs and to show up for the Prince George's County community?
I think maybe knowing each other and kind of what we do, maybe some, some value. I know that we have the introductions, but perhaps maybe in introductions there could be an ask at the end, right? Like, so, I'll introduce myself, where I work, and if there's anything that I need, and everyone else can do it, and that way we can just become familiar. Like, what do you have to give, and what do you need, as we do our introductions, or maybe, something of the sort to maybe create a little more cohesion, especially since we are like a work group, because right now, and I spoke to you about this, Taylor, that it feels very, we come and we get the presentations, but outside of that, I'm not really familiar with most of the folks here, and they may not be familiar with me in terms of how I could support them, or how they could potentially support me in the work, in the county. So that's a random idea, just to also fill the space of silence.
Thank you, Dr. Blunt. And I know, we have several partner presentations that we try to offer throughout the year. But if, partners who are on the line, it doesn't have to be anything formal. If someone would like to just prepare a slide about the organization that you represent, and we could dedicate 5 minutes each meeting to just meeting a new partner. Certainly, as new folks join, we'll have to think through what some orientation materials may look like. And so it may be good to prepare some of that information, and have that readily available to share during the meetings, if that's of interest.
Yeah, maybe like maybe a section each time where we have like a speed 60-second presentation from a member. You know what I mean? And they'll know prior to that, like, this is my month. You know what I mean? So it's something.
Sounds good. Well, I can reach out to folks with a calendar for the rest of the year, and see if folks are interested in signing up, and then I can keep track of all the information that we share, and create some sort of a shared document amongst us all that folks can go back to. And if you need to reach out to someone in particular, you'll have their contact information. And I see here in the chat here about, is there an updated directory of all behavioral health services in Prince George's County? So, so Sylvia, yes. So there are a few different lists. We have one through our website. It's called PGC Health Zone, and we have a behavioral health list that we've used in the past. The problem with that is we don't have enough staff power to maintain that list and keep up with it and go through and remove any redundant or old contacts. And so we're adding folks to that list, but we haven't really done a good job of keeping up with it and making sure that information is still relevant. So we have done an overhaul and trying to get folks engaged and find help, adding and claiming their programs and find help, and using that as a community resource inventory. I know Denise, she did a presentation, I believe late last year, to the work group about find help in accessing that community resource inventory. So I can see where they're at with that from the behavioral health division here at the Prince George's County Health Department, and get you an update there and see again if that would be an area that the BHAG would like to become active in, and figuring out, again, just doing a landscape analysis of what's out there. And I see Felicia, yes, I can send you all that information. What I'll do is I'll include that in the meeting notes that are going out today, and I'll highlight those resources that I just mentioned. And I see Divine Intervention in Greenbelt, Maryland, and Pyramid Healthcare. Certainly, I will reach out to those folks. Alrighty. Well, just in the interest of time, I'm going to go ahead and shift us over to our community announcements, but please keep thinking about all of these these areas of focus in 2025. And, as we start to create, we'll have a new community health assessment coming at the end of the fiscal year. And then we'll have a new community health improvement plan where we'll talk about our new goals and our new priorities here in Prince George's County. So keep thinking through, and again, communicate if there's anything that you need between these meetings. We are certainly here as a resource. If you have any information that you'd like to share at a meeting, do feel free to reach out to me in between these meetings, and I am happy to support. So moving into our community announcements, Tanisha, if you are still online.
Yes. Hello, everyone. My name is Tanisha Whitlock. I am the community health manager at Capital Region, located in Largo, Maryland. I'm also a licensed master social worker. So I'm here on this call as a social worker, not as the community health manager at Cap, but I do represent them as well. I just have an announcement about our upcoming trainings, mental health first aid training classes. We have a class coming up on March 8th. On Saturday, it's fully free and it's 100% virtual. So it's an all-day class, and you will receive certification at the end. There is pre-work required, so there's about 20 minutes of pre-work required, and then you will join the class from 9 to 3:30 p.m. And then there's a post-test after the end of that, and then you pass that post-test, and then you get your certification online. Just to give you some information about mental health first aid. Mental health first aid teaches skills needed to recognize and respond to signs and symptoms of mental health and substance use challenges, as well as how to provide someone with initial support until they are connected with appropriate professional help. So this is for individuals this is for everyone. You don't have to work in the mental health space to become a mental health aider. This is for someone who, you can be at the bus stop and you come in contact with someone who is having a mental health crisis, and this class or this training gives that person the tools to try to de-escalate the person or understand the signs and symptoms of someone who is experiencing a mental health crisis, and understand that someone who is experiencing a mental health crisis isn't always dangerous. We want to kind of eliminate the stigma around mental health and all, so this class is really, really important. So this is for anyone that works in any space, law enforcement, you could work in the school system, anyone. So we really encourage you to share this information, to share this training with individuals, because our goal is to eliminate the stigma surrounding mental health in Prince George's County. We do have this class coming up. We only have about 5 slots left in this class, but we also have a session in May. It's going to be youth mental health first aid training. So that's for individuals that work closely with the youth, so they can understand and recognize the signs and symptoms of mental health crisis in youth. It is for adults though. And we also have another class in August that will be adult mental health first aid, and the same, they're all free, they're all virtual, 100% virtual, and they're all on Saturday, so not during the work week. You can spend your Saturday learning about mental health crises and substance use. So I will share the link in the chat, and all 3 of those trainings are listed on that Google form, so you can send this link to everyone and anyone you know. We really, really, really is really excited to give you all this training here in Prince George's County, free of charge, at home, virtually, comfortable. You're comfortable in your home, and I hope we get a full training like we did before when I shared it with the other work group. And thank you for letting me share, Taylor. This is great.
Thank you so much, Tanisha. Any questions, Ms. Cheryl?
I'm sorry, Taylor. I raised my hand because I found the person, but I want to reach out to her first. This is Crystal Evans and Dr. Blunt, so that you know this too. Crystal Evans, she's with the Community Research Advisory Council at Johns Hopkins University. Let me ask that question. Is there any ongoing research that we can get access to? And I'll share that. And I'll share it with you, okay? Thank you so much. I'm sorry. I didn't mean to interrupt at that moment.
No, that is always a welcome interruption there, Ms. Cheryl. Thank you so much. Any other questions for Tanisha? And again, I will provide this registration link in the notes for folks to reference after the call and share with your networks. All right, and next, in honoring and celebrating Black History Month, our friends over at the Prince George's County Department of Parks and Rec, they have a few more events happening through the end of the month. 2 events are taking place actually this Saturday. So a free Headshots for Success event is taking place. And then we also have the Afternoon Aviators in recognition of Black History Month taking place this Saturday as well. So I will be sure to send you all a link to the calendar. You can take a look at those events. There are also some events taking place in early March, some different seminars for folks to join and different ways to get involved in the community and hopefully walk away with a beautiful new headshot on Saturday. So I will be sure to include that link in the meeting notes if anyone is interested in partaking in any of those activities and celebrations. Next, we have an announcement from the Prince George's County Health Department regarding the Extreme Risk Protection Order Liaison Program. And so there are two opportunities to get involved. So here's a direct ERPO liaison partnership support effort, and then a category B broader preventative and responsive services. So 2 opportunities for community-based providers to get involved. I will send all this information out via email. I am not going to pretend to be a content expert in this area, but you can email Brittany Vasquez with the Behavioral Health Division if you have any questions or if this is something that sounds like it is right up your alley. So I will be sure to send out this information to folks to take a look at after the meeting. Next, we have supporting our partners over at Vibrant Health and Wellness Foundation. They are hosting a partnership for a Healthier Prince George's County conference taking place on Saturday, April 5th from 9 a.m. to 3 p.m. at the Prince George's County Community College. I know that I will be there and talking about the coalition and building some of our partnerships. But if this is of any interest, I will include the flyer in the meeting notes, and also that QR code at the bottom of the page will take you to the registration link. So hopefully will be a good time for partners across the county to connect and talk more about their services and see how we can partner and break some of the silos. And I will just go ahead and open space. Are there any other community announcements that folks would like to highlight?
I would just want to say that if anybody knows anyone that's interested in working as a therapist or in a therapy space, I'm hiring for therapists to provide virtual work in a private practice. Really looking for entrepreneurial-minded therapists who, want to eventually start their private practices. And so I'm just putting it out there, just in case, anyone is interested. They can email me directly at shatia@inme.com, and I'll put that in the chat. Thank you.
Great. Thank you so much. Good luck in your search. I hope you find the perfect candidate that you're looking for.
Yes, thank you. Thank you.
And Felicia, I see your hand.
Yes, quick question. Shatia, are you taking interns as well?
I love students, so I would consider a student, yes.
I have 2 roles. I have the private practice, and then I'm an instructor here at the Chicago school. So we're always looking for new sites to send students.
Yes, let's connect. You have my email. Could you send me a message, or could you drop yours and I'll message
Sure.
you?
Sure.
Okay,
I'll
thank
just
you.
I'll put my email in the chat. Great.
Thank you.
Hi, this is Dr. Kokonam. The Prince George's County Department of Correction is also looking for interns to serve at our Community Relief Center as well as the facility. We are actually listed as a site for you. I think we still have the MOU is still active. So we're reaching out. We're looking for students to join our team.
I would imagine that the intern positions are not paid, but the other positions
No,
are.
they're not
Is that
paid.
correct?
Yes.
That's correct.
Okay.
Great. Any additional community announcements? And Sylvia, I'm sorry, I think I missed your question there in the chat for the event. Was that regarding the conference?
No, the previous one you said for Black History Month celebration. Yes.
Yes, these are free and open to the community events.
Great, thank you.
Of course. Any other community announcements or upcoming events that anyone would like to highlight? All right, well, thank you everyone for your attention and your feedback today. Really great brainstorming session to have here, and hopefully figure out our roadmap of where we want to go in 2025. So just to put on your calendars, our coalition, the Prince George's Health Action Coalition, we meet quarterly. We will have our next quarterly meeting on Tuesday, March 11th. We switch off, we rotate between going virtual versus in person. This quarter, it will be held virtual via Teams, and that'll take place from 6 to 7:30 p.m. on March 11th. And then we will reconvene as a BHAG next month on Wednesday, March 19th from 3 to 4:15 p.m. Of course, if you need anything in the meantime, please do not hesitate to reach out. I will send all of those who indicated that they were interested in attending tomorrow's Health Equity Workgroup meeting. But as always, if you need anything in the meantime, please do not hesitate to reach out. And please do take good care in these times between our meetings. And yes, again, let me know if you have any ideas in the meantime, and always happy to chat offline. But otherwise, thank you so much.
Thank you.
Thank you. Bye-bye.
Have a good day.